The Rio Grande Valley, Texas, one of the fastest growing regions in the country, with a population growth of over 24% and hundreds of thousands of new residents added within the decade. For decades, South Texas lacked critical access to healthcare services. With the dynamic growth of the region, there was a mounting need for better healthcare.
In 2003, local physicians came together to create a full-service general acute care hospital to meet that need.
DHR Health, for you, for life.
We built this hospital so we could be the very best physicians we could be. DHR is managed by the same physicians who deliver the care at the bedside in our hospital. We put the patient at the center of everything that we do.
As doctors, we're at the bedside of our patients. We know firsthand what they're experiencing. If we have any difficulties with their care, we can take the problem to the boardroom and immediately resolve their issues for the betterment of their care.
At DHR Health, I am the Chief Medical and Compliance Officer. We make sure that the physicians and the health system as a whole is complying with state and federal laws. We also live here, so it's very personal. When I take care of a patient, it's my neighbor.
When you are committed to providing care for your community, then it's easy to see how this farmland was converted into a 130-acre campus with more than 24 buildings and over 500 hospital beds and growing. The hospital system counts on over 700 practicing physicians, nearly 1,200 nurses, and over 4,700 employees, and an annual economic impact of more than $1 billion. DHR Health is proud of its partnership with Starr County and to provide specialty services like cardiology, urology, and gastroenterology to an underserved community, full-service laboratory, a research facility, and graduate medical education programs will help bring more care to the area.
The list of achievements at DHR Health continues to grow. The first comprehensive stroke center accredited by the Joint Commission in the region, the only CMS certified transplant facility in South Texas, now performing 50 transplants annually. Inpatient and outpatient behavioral health services, the first to offer urology oncology and gynecologic oncology services. And most recently, we've expanded our services here in Cameron County with DHR Health Brownsville.
In addition, DHR Health brings the most comprehensive emergency care to the area and is the first Level 1 trauma center designated by the American College of Surgeons south of San Antonio.
At DHR Health Women's Hospital, we provide care for the unique health needs of women of all ages and deliver nearly 800 babies a month. The support of administration at each phase of our growth and development has allowed us to become the only Level 4 maternal facility in the region. This validates that we provide the highest possible comprehensive care for women and are able to treat the most complex cases.
The DHR Health Breast Center of Excellence is a necessity in the Rio Grande Valley. We are the only center south of San Antonio that is accredited by the National Accreditation Program for Breast Centers. We provide the entire spectrum of collaborative services right here at DHR Health.
Our behavioral hospital includes 88 beds and is the only facility in the area that has a board-certified pediatric psychiatrist on staff to complement our diverse team of highly specialized psychiatrists who provide quality care through an individualized treatment approach. In addition, our outpatient services provide access to routine mental health care. Community outreach and education is important, and we are committed to partnering with local and neighboring agencies, schools, and first responders. Mental health matters, and at DHR Health, we are here for you.
DHR Health has the highest level of technology available for patients here in the Rio Grande Valley. We are proud to have a CARP-accredited facility in stroke, spinal cord injury, and amputation, and to partner with Exobionics to enhance our rehabilitation programs. We have designed comprehensive inpatient and outpatient services that include a rehabilitation hospital, cardiac rehabilitation, orthopedic and sports therapy, neuro rehabilitation, pelvic health, aquatic therapy, and lymphedema management.
DHR Health was instrumental in helping to bring Driscoll Children's Hospital to the RGV, the first and only fully licensed children's hospital in the region. Driscoll Children's Hospital will be open in 2023, providing a full and comprehensive level of specialty care to the children of the RGV. Our services also include researching new ways to bring the best healthcare to our community.
DHR Health Institute for Research and Development is the largest and most comprehensive nonprofit entity in the Valley. It has nearly 300 on clinical trials that are funded by the NIH and other federal and biopharmaceutical sponsors.
In 2017, DHR Health began a residency pharmacy satellite program. This program supports an average of 15 students a year across the introductory and advanced pharmacy practice experiences. At DHR Health, we believe in developing visionary leaders for the future of medicine and our community. We now offer residency programs in family medicine, general surgery, internal medicine, obstetrics and gynecology, urology, and a transition year program, as well as 6 fellowship programs.
It's all about the patient and the community you serve. If you're true to the community will be true to you.
Physicians want to help people. They dedicate their lives to alleviating suffering and pain. A physician-owned hospital? Well, that's a label. This is a hospital that is built for the community.
DHR Health, for you, for life.
Well, thank you. We are very proud of what we do here for our community, and thank you for visiting us at DHR Health Brownsville. So that was what we do today. I'm going to talk to you briefly about what we want to do for future. And the word I would like to use is transformational. So here you are visiting, and I'm going to implore you to help us in the transformational proposal to establish Texas as a national leader for medical research and Hispanic medical research. These are some facts I'm going to talk about that, and these are the things as a physician I'm still practicing, and I see that in our community. Let's start with some few facts. What's the future of Texas and why we are here asking for this transformational approach? Hispanics, they will comprise of 50% or more of Texas population by 2030. Challenge. We all know they have a higher incidence of chronic diseases, diabetes, high blood pressure, heart disease, fatty liver disease, kidney disease, you name one. It's going to be a big problem of Texas economy, and I'm going to talk about that in a little bit. So what is the transformational impact I'm talking about? To be a leader in an innovative Hispanic medical research by investing in state-of-art research facility here in Rio Grande Valley, where 95% of population, actually it's 94% to be precise, are Hispanic, and economy is ripe for the establishment of health science ecosystem. So how does it make sense? So going back to the increasing population of Hispanics, between 2010 and 2020, 95.3% of increase in population was attributed to minorities, and 50% of them were Hispanics. Fact number one. Number two, most of them, if you look at the current populations, the Hispanic population is the younger population, especially in 20 to 45. That's the most productive. Why is that important to you and us? Because these are the people who will run the economic engine today and tomorrow and for the future. It's very, very important that we take care of those people today. You can see 37.9% is basically part of the labor force today, but by 2030 it will be 40%. 40% of Hispanic, which will be 50% of the population, and which majority will be between age 20 to 45, will be the one who will be running the economic engine of state of Texas. It's a great opportunity, but there is a problem too. It's not just Texas. And that's what I'm going to talk about. What is happening in Texas today is going to happen in nationwide tomorrow or day after. You look at this is the national data. The Hispanic population is 21%. By 2030 and by 26, it will be 27.5%. That's a 93% increase in the population. The state of Texas has an opportunity to become the national leader in research that drives innovation in Hispanics. Why? As I mentioned, the diseases, the chronic diseases, which can start when they are in kids, in schools, very young population with diabetes, heart disease, high blood pressure, kidney disease. I see them all the time. We try to take care of them, but because of these diseases, they go off the workforce pool. And that's something which we cannot afford as a state of Texas. The incidence of disease, this is the most mind-blowing slide I've ever seen as a physician. You see the disease population, this is in million. Just look at the red one. In future, there will be 40.7 million incidence of diseases in white population, black population, but you see 71.3 million. That will be the disease burden for the Hispanics. And the worst crime, which I think is Hispanics, there is a big disparity of Hispanics in any of the cutting edge research that is being done in the state of Texas or nationally. 19% of population is Hispanic, but some studies say 1%, some studies say 5%. Only 5% of the population of Hispanics are included in those studies. And why is that important? If you are studying on some other ethnicity and using the same research and medication on Hispanics, there is a big chance it may not work. How do we know that? We did a study. What's the most common drug as a heart patient anybody takes other than aspirin? Plavix. We found that Plavix does not work on Hispanics because it does not get converted into its active form. Imagine we have been giving these medications to our populations. So imagine the disease burden on the population, which we call the future of workforce for Texas. So it's very important to invest in bioscience industry and economic engine. And this is something new which we are asking for, has never been done in Texas. It has been done in San Antonio. I met some reps from San Antonio while they were walking in. They know that if you invest in bioscience, by economic multiplier is $2.36. You invest $1, $2.36 are generated. You employ one person, 3.82 extra employment is generated because of the surrounding field. And right now, only $4.9 billion of venture capital funding is coming to Texas, as compared to 79 or 80 billion dollars for California, $41 for Massachusetts, and $18 billion for New York. You think they are better than us? I don't think so. So what's missing? It's because we don't have the critical infrastructure to do the research on Hispanics here in Texas. And I will explain to you why South Texas and Rio Grande Valley is very important in that. Going back to San Antonio, they have already done it. In 2005, their impact was $14.3 billion, which is where we are right now in the Rio Grande Valley. It's $13.7 billion. But in 2015, the impact was $37 billion. 24% of the workforce and the 50% of the new net high-paying job created during this decade. So we have done this in San Antonio. It's nothing new. We can do this in the Valley also. DHR Health Institute of Research and Development is a non-for-profit 501c3 institution. So what are the three things that is important for any research? Patients, people, and infrastructure. We have the patients. We saw the increase in the population that's going to happen. People who can do these research. You saw what DHR Health has done in last 18, 19 years. We have the best physicians, we have the best healthcare workers, we have the best researchers. So what is missing? Missing is the infrastructure. And that's why California gets $80 billion, we get only $4.9 billion. What do we need? We need adequate space to get all those trials, biobank, infusion center, research education. We need technology, gene sequencing, radiology, advanced informatics, and advanced pharmacy. DHR Health has already accomplished. We have started, when we started, maybe 10 or 20 studies. Now we are doing 220 studies, some of them are funded by NIH and national grants. We are supporting a level 1 trauma. We are supporting a stroke, and we are supporting the infectious diseases. The best thing what DHR Health and Research did was during COVID. The best part was that, and we are very proud of that, and it was not restricted to only DHR. It was a valley-wide initiative which DHR Health Research Institute led. Any new medication that was released on the television, you would see, would be in the valley in 2 days, because we had this research fund and we had the connections and we brought them down. It helped in taking care of our community, our family members down here in the valley, and DHR is very proud of that. We have attained all the national level accreditations which is needed, which brings us to the table, which gets us the seat of the table amongst the big boys, that we are not just any JV team. We are the real deal, and that we have achieved all of them. I don't want to go into details, but we have already achieved. We already have affiliation with UTSCI. We have affiliation with Texas A&M, University of Houston, Baylor, MD Anderson. We are doing research with them. They know we are good. They know we are the real deal. We are doing cutting-edge clinical trials. We are the economic engine of the Texas. It will also further strengthen and build bioscience ecosystem around the state of Texas. But more importantly, what is happening in the Valley today is going to happen in the rest of the country tomorrow. So anything when the rest of the country starts to do for Hispanics and the minorities in the rest of the country, we want to be in the forefront and have done the research on them already, and we will teach them how to do those things. That's our dream, that's the dream of DHR Health, and I know this is the dream of all of you guys. So this is the facility we are, it's an ask, it's going to be there, and it's a one-time transformational investment for the future of Texas. It's because I personally believe, as a clinician, I've been here for 11 years, it's not that something people in the Valley need. It's not something people in the Valley want. It's something people in the Valley deserve. Thank you.